Hi, this is Grace Thornton, and I am doing my intervention toolkit assignment on stimulus control. Stimulus control was first developed by Richard Bootson in the 1970s, and he kind of extracted the concept from Pavlov dog's experiment, and I think a lot of us have heard of that experiment before, where the dogs were conditioned to salivate when they heard the ring of a bell, and the association was between getting food and then the bell ringing. So even when the bell would ring and they wouldn't get food, they would salivate. So Bootson kind of took that idea and developed stimulus control theory and turned it into a treatment for insomnia. And stimulus control theory, it falls under the larger umbrella of cognitive behavioral therapy, which CBT itself is a very big topic, and I won't go into that at all because it's a whole other discussion. But CBT is very popular and is used by a lot of therapists in psychotherapy, and it can cover a really wide range of either mental health issues or emotional issues. And that can include like PTSD, eating disorders, depression, sleep disorders, even like schizophrenia and substance abuse. So think of stimulus control theory as kind of a smaller, more specific tool under the CBT umbrella. Stimulus control is considered a single component intervention, and that's because it's very specific in what the tool is trying to change. So it's often used in conjunction with other theories and other tools. So that can include like prompting, self-monitoring, and like I mentioned before, the cognitive therapy. And stimulus control, a good example is when people are driving, and if you see a red light, we're kind of all conditioned to stop. When we see a green light, we're conditioned to go. So to break it down into the most simplest of terms, that's one example. And you can see how it can relate to kind of Pavlov dogs and how when they would hear the bell, they would have a salivation response even if they weren't being fed. And one thing that's interesting about stimulus control theory is that it can take into account the environment. So in my readings, there were a lot of examples that included people changing their environment to change their behavior. For example, someone who maybe has a alcohol problem, if they reduced their exposure to a bar or just general environments where they would be more prone to consume alcohol, then reducing exposure to those environments reduce their alcohol consumption. And the end goal of stimulus control is to create a lifestyle change that will evoke the desired behavior. So the point is to be able to kind of create a habit that will lead to the outcomes you're looking for. Currently, stimulus control is very popular for insomnia. It's used at a lot of medical facilities. I found different medical facility websites, across the country that list it as a treatment for insomnia instead of using medication. And that's because you can kind of change behavior associated with sleep, and they have good outcomes. It is evidence-based for the treatment of all types of insomnia. There are different types of insomnia, and stimulus control is something that can be used in all of them. It can be difficult to measure success with stimulus control because it's a self-reported type of behavior change, and anything that's self-reported tends to have a certain amount of error or skewed reporting. and it can be kind of difficult to test it objectively um, in general. And in terms of risk to the patient or client, stimulus control tends to be very low risk. Those who use it should be appropriate to do so. So if a therapist should be teaching a client how to use stimulus control, it shouldn't be used by someone who's not trained or maybe credentialed to be doing that. That could be a risk factor, is if someone who maybe doesn't quite know how it's used is using it for the wrong purpose, but in general it seems to be low risk. These are the instructions for stimulus control for those with insomnia. And you can see they get pretty specific and kind of help create behavior change and the association that someone will have with the bed and bedroom for sleep. The main goal of stimulus control for insomnia is to associate the bed and bedroom with sleep rather than those who have insomnia. As soon as you start to think about trying to fall asleep or it's getting to be kind of that time in the night, it can be kind of stressful and anxiety inducing, and that just furthers the problem. So the whole point of these steps are to change that stimulus of the bed and bedroom and then hopefully lead to positive behavior change and allow the person to sleep better. And I won't read you through all of those, but they're there. A few things that I brainstormed for the repurposing of stimulus control. A lot of things that came to mind were visual cues. For example, visually seeing a bottle of multivitamins sitting on the counter, and more specifically, those women who are of childbearing age should be taking a prenatal vitamin every day in case they get pregnant, that they have better outcomes. And visually seeing the bottle of prenatal vitamins every day could possibly increase the behavior of taking it, versus if they're tucked away in a cupboard or a drawer, that reminder may not be as helpful. And then a similar visual cue to the consumption of like alcohol or soda intake. I mentioned that stimulus control, that if someone takes themselves out of the environment, that may lead to alcohol consumption. If you don't have the visual cues of alcohol or soda in the home or at work or out and about, might have decreased intake and positive behavior change from that aspect. And another one was wearing exercise shoes may prompt more physical activity. This kind of came from my own personal experience. I feel sometimes on a Saturday, if I have exercise shoes on, I'm more likely to do more chores around the house or go run errands around town. I just tend to be more productive, which can lead to more physical activity. So it doesn't have to mean going and doing like a formal workout, but even someone who's maybe trying to increase their number of steps in a day, wearing like comfortable exercise shoes might help to increase that. And another one, possible repurposing for stimulus control, was eating meals at the dining table might improve meal quality and frequency. So if a family might struggle with eating meals together, or even cooking at home, if they use the dining table maybe as a stimulus for sitting down, having a meal together, even if initially they don't start cooking at home, if they pick up something on the way home and then physically sit down at the table and eat it there, that might lead to more meals cooked in the home, better meal quality, and then even more frequency of eating at home together. That is kind of my summary on stimulus control. If anyone has questions, let me know and I will get back to you. I'm not going to claim to be an expert in this at all, but I will do my best to answer your questions.